Hi, good morning. I'm Martin Caraher. I'm Professor of Food and Health Policy at the City University of London. I'm really glad to be joining you this morning, although not in person, which is a bit of sadness. I've liked another visit to Jerusalem, but perhaps another time. So I'm going to go straight into my presentation and hopefully we'll pick up some of the issues later on. Okay, so there's my title. I'm going to talk about food aid and the flight from welfare and some of the hidden costs. And these hidden costs, my three main issues will be those of austerity, charity, and food rights, which I'm going to cover in detail in this presentation. I'd caveat, some people may feel this is an attack on food banks. It's not, it's an attack on food banking as a system, and that becomes in many ways the dominant system of food aid and overrides that of state aid. So bear that in mind. Food banks do great work. I want to start with two quotes, one from Tom Morello, a musician and political activist in the US. At an anti-poverty event, he said, "Hunger is a crime." And on your right, you're looking on the screen, Ziad Rabini, a Lebanese composer and political commentator in a poem and now song, a very famous song in some activist circles. "I'm not a heathen, but hunger is heathen." And they're both making the point that really hunger is an unnecessary issue in the modern world. So just to remind us about food insecurity, I presume this has been covered in other sessions, but it's a range. It ranges from mild food insecurity to moderate food insecurity to severe food insecurity. And of course, people go in and out of this in cycles, even monthly cycles. It may be mild at the beginning of the month when people have money and resources, and towards the end of the month, severe food insecurity. So it's a problem across many populations, and we're seeing more and more, especially in the developed world, that food insecurity is now becoming a problem of low-income working people, not just those on welfare systems. So from the 1940s onwards, post-World War II in the UK, it was felt that the welfare state established in 1948 would do away with poverty. And charity, to some extent, faded into the background. There were some fringe food actions in our welfare policy, such as welfare foods, which is the equivalent of WIC in the States, Women, Infant and Children Program in the States, so healthy options for pregnant women. School meals, which still continues today, and Meals on Wheels for the elderly. Now, Meals on Wheels has largely disappeared from our agenda currently. It's not funded to any great extent anymore. But food poverty, FP, was rediscovered in the 1970s by the NGO sector, and key among these was Child Poverty Action Group and a group called the Caroline Walker Trust, named after a very famous nutritionist. And a group of academics, key among these was Peter Townsend, who talked about relative poverty and the need to build food into poverty indicators. So after that, in the 2000s, I'm skipping through to the 2000s, we had a growth of the food banking movement. We now have over 3,000 food banks plus 2,000 other types of charity provision, from pantry provision to community shops. Some of us see food banks as successful failures. There's successes in the fact that they're growing, and they are addressing hunger issues, but they're not addressing nor can they address the underlying issues of food insecurity. Here in the UK, we have lots of pilots. The government are unclear about what to do, but they commission another pilot. So we have what I call pilotitis. And we've got small-scale fringe movements offering solutions which across the country, which are great, but they're not and cannot address the underpinning issues and underlying issues, the social and structural determinants of poverty. So we're seeing increases in food poverty and inequality, and I'll show you some figures in a moment. But we've also seen austerity as a political move, resulting in the loss of capacity and money and focus on individual culpability. And we've seen during the pandemic, as I think you probably have seen in Israel, a lot of interventions, including topping up of incomes, but these are now being stopped because we're not out of the pandemic yet, I would argue, but monetary top-ups have been stopped. So people are going to go back into poverty, combined with the current crisis from the Ukraine, with rising food prices, rising fuel prices. Currently, our food Our food inflation is running about 15 to 17%. So what we've seen since 2008 in the Great Recession is cutbacks in public services, this austerity I talked about, and a focus on individual behavior, and a focus on obesity. Obesity has become a key concern. There are links between poverty and obesity. And we've seen a divorcing of food poverty from poverty campaigns. I think we need to go back and recognize that food poverty is part of poverty, and bring the two together. And we need to revisit food and relative food poverty. These are some work I've been doing. You can click on the links and go to these pieces of work. One's a commentary on a new food strategy for England, which doesn't mention food insecurity. It's not mentioned in it because it's seen as too contentious. And the other is some work we've been doing on screening for poverty in primary care. In 2013, the UN Special Rapporteur, Olivia de Schutter, said in a talk in London, food assistance in the form of the right to social security, such as cash transfers, food stamps or vouchers, can be defined in terms of rights. And I think this is important to remember, that is a right to food. Whether countries are signed up to the UN Declaration of Human Rights, but there is a right to food. Whereas food banks are charity-based and depend on donations and goodwill. And he also said there will be a sense of shame, of course, attached to using food banks. So we've seen, as I said, this austerity politics happen in the UK, a cutback in public health services, a cutback in nutrition services, hence the growth of charity provision. And that's good that charity has stepped in to fill a gap, but it's become clear it cannot fill the gap in the same way that government can do. And again, austerity politics. Philip Alston, the previous UN Special Rapporteur on Extreme Poverty, concluded that the UK government's coronavirus response was utterly hypocritical after successive administrations introduced policies of austerity and public sector cuts. So some of the things he's saying we're seeing are a result of what government previously done. So in the UK, 1 in 5 families pre-COVID lived below the poverty line. So 14 million individuals, and within this 4 million children. We reckon this has gone up to about 22 million with the COVID crisis. So it's significant. And I would say within that are some hidden factors as well, some hidden data that we haven't quite got the grips yet. The people who go hungry and overweight are largely the same groups. So we've got obesity strategies, and we've got some anti-poverty strategies, anti-food poverty strategies, but actually the root causes are the same. We should be looking at them as the same, with the same lens. So the link is greatest between poverty and outcomes such as obesity in the developing nations. It's part of the triple burden. So we need to be hunger and overweight are largely occurring in the same groups, even in the same households. So this is data. This is just before COVID. If you look at here, already our figures were going up pre-COVID in 2018, 2019, the number of children in poverty. And of course, this is massively increased with COVID. Our figures are a bit iffy from COVID data because they're not totally comprehensive, but do know that they've gone up. So, and my point is food poverty and obesity are linked, yet we have separate policies and never shall the policies meet. And this is about overweight and obesity. I mean, overweight among children, this is year 6 or 12-year-olds. This is the most deprived decile. The numbers are going slightly up. This is the least deprived decile. It's going up, but not as high as those in the most deprived decile. And here again is the inequality gap, again increasing and then slightly decreasing in 2019-20. But our early indicators from COVID are that again, this gap has increased. So it's child overweight and obesity can be relinked to insecurity. What we saw in COVID was a 5-fold increase in numbers seeking help from food banks. And food banks couldn't cope. They couldn't cope with the demand. They couldn't access food. Their own volunteers were often subject to COVID restrictions. So we had a problem in terms of serving people in need. And the government didn't step in. It left this to the food banks to solve. So we have, just to point out, there are different things happening in the different administrations in the UK, Northern Ireland, Wales and Scotland. And the Scottish government have Nourish Scotland, which is about building in a right to food. It is really worth looking at that. But it is to point out that there are slightly different approaches in the four administrations of England, Northern Ireland, Wales, and Scotland. Although from a financial point, it's driven from England, from London, from the Westminster government. And here are some examples of things you can look at. Here's the right to food is an ongoing debate since 2004. It's recently been given new life here in the UK. We've got MPs campaigning for the right to food, and I've given you a link there for food banks linked to football clubs. As I said, the Scottish government and Nourish is worth looking at. So these are things you can look at later. They are worth looking at. So the UK, I mean, we remain one of the most unequal societies in the world in the UK. I think the US is ahead of us, and we vie for second, third place with Australia. And the UN special rapporteurs on food and extreme poverty have been really damning about what's happening in the UK in relation to tackling food insecurity. This is an overall ranking. You can see we actually look like we're 6th, Israel's 8th in terms of food security, but this is only about national food supply. It's not about how it pans out at the household level. And this is done by The Economist, and this one here. Singapore dropped. Singapore was number 2. It's dropped, I think, down to number 20 on that list, partially because of its offshoring of its food supply. But I mean, there's different ways of looking at food insecurity. And again, examples in the UK, we've had one of our celebrity footballers has done more for food insecurity than the government have. He's kept the issue on the agenda. He's lobbied for change. He's talked about the need to support families. His name is Marcus Rashford. We had a House of Commons Environment and Food and Rural Affairs Committee recommended that the extra monetary aid established during the pandemic should be maintained post-COVID. That's not happened. So examples from a wider field, if you want to think about what's happening globally, probably one of the best examples is Belo Horizonte in Brazil, where they have public, private, and a mix of food banks, both public and private working together. And they've set up standards, nutrition standards for food banks. Ontario 90, Freedom 90, a union of food bank workers. Again, you can link on that and see what they've done. They've made demands about how to end hunger. And these are food bank workers. They say food banks are not the solution. There's a new book called Reinventing Food Banks and Pantries. And there's also a whole new body of work on social or solidarity supermarkets and co-ops. This is my colleague, Andy Fisher, who talks about the global food banking network and the negative impacts of dealing with the food industry and the charity industry getting into bed with the food industry. And he links these. If you go to his book, Big Hunger, it's chapter 4 there. And we're finding something similar in the UK. It's absolutely, 20 years of food banks in the UK have shown no overall improvement in the underpinning food poverty rates. They've got worse. And that's not a fault of food banking. Food banking can't be expected to address these issues. We've seen links and growing links with unhealthy food industries are increasing between food banks and these industries. And I'll show you some slides in a moment. And there's evidence during the pandemic that food banks could not meet the increased demand. They had a lack of records. They had a lack of food. They had a lack of volunteers. They didn't have the records about who was coming to them, because people might give false names. We didn't have a comprehensive list. And because of the austerity cuts I talked about earlier on, public health was not in a position at a local level to deal with this. So this is some of the unhealthy food commodity industries. McDonald's joins forces with FairShare, which is one of our distribution points that takes surplus food from the food industry. So McDonald's are joining with FairShare. The Trussell Trust, which is our main food bank movement in the UK, have linked with Cadbury's, and Coca-Cola have linked with FairShare. Now, the interesting thing about this is, WHO have raised the issue of links with unhealthy food industries, but we're seeing it through the back door with the food bank movement. And of course, we have to ask who's gaining most from this. This is giving a halo or a shine effect to these unhealthy food commodity industries. It also raises issues of funding for researchers. If researchers are taking money from these charities, how do we separate that money or funding from the unhealthy food industry commodities? And I refer to Andy Fisher's book. In chapter 4, he details a case study of how that was a major problem in the US. Okay, so it's nearly finished. We could and should be using the lobby of the food bank movement to bring about change. I mean, here's a powerful lobby, a powerful group, lots of people involved, but lobby for what? I think the end to hunger. We don't know enough about the views and attitudes of frontline staff and volunteers. Is it about charity? Is it about help? Is it about worthiness? I think we do need to know more about the attitudes of frontline staff. A recent example in the UK is we've cut our foreign aid budget from 0.7 to 0.5, and the general public are in favour of that. That really worries me personally, but we do need to more of that sort of data. How do volunteers, how do the public view charity and food banks? And we need to move, as they have in many countries, food versus cash. We need to give cash aid. Cash transfers are proven to be more effective than giving people food in kind, as in food baskets and food pantries. And that's it. I hope you have a good morning, and I hope the rest of the conference goes very well. Thank you.